The impact of culture on nursing roles in Japan. Culture is defined as the ideas, customs, and social behavior of a particular people or society. In relation to nursing, cultural practice is a standard of excellent care that is provided, and how the practice is able to achieve that level of excellence. In Japan during the 19th century, the Meiji period brought about change that led to a revolution and saw westernization taking shape around the country. Prior to the Meiji era, Japan's nursing standards were based on traditional Chinese medicine. Following the Meiji Restoration, in the early 1900s, a number of medical regulation authorities were established. As such, laws, updated practices, and the reviewed expectations of nurses in Japan advanced. Legislations of the Ministry of Health and Welfare now govern the way in which nurses practice. In 1948, the Act on Public Health Nurse, Midwife, and Nurse came into effect. The law changed the status of existing nursing professions and awarded formal license qualifications to those that passed nursing examinations. A year later, legislation around designated training schools for public health nurses, midwives, and nurses became available. In 1952, introduction of the first 4-year university course in nursing rolled out in Japan. Now, Japanese nurses have similar scopes of practice to those in Western healthcare systems. There are 3 general themes for cultural characteristics of nursing practice that now govern Japan. Number 1, practice expectations. Japanese nurses now fall under the same expectations and responsibilities of other nurses across the Western world. Number 2, communication. Japanese nurses are expected to rely on a balance of verbal and nonverbal communication to deliver thoughtfulness and perceptiveness to their patients. Some forms of nonverbal communication can be expressed through facial expressions, gestures, and body language. And number 3, building relationships with colleagues. Nurses are encouraged to show respect to doctors and colleagues through building rapport in the healthcare setting. In turn, this supports patient care through the maintenance of a pleasant, collaborative environment. Values and beliefs about healthcare. Due to the combination of both ancient and new philosophies, it is thought that the central values that impact Japanese nursing come from various religious beliefs. There are 3 predominant belief systems embedded into the culture of Japanese nursing and sculpt the healthcare system: Buddhism, Shintoism, and Qi. Buddhism focuses on treating illness naturally, with Buddhists believing in rebirth and natural passing. It is widely believed that meditation promotes concentration, awareness of the present, and enables a level of self-insight, and is still encouraged in nursing care today. Shintoism, on the other hand, assumes health and cleanliness is equal to spiritual purity, while sickness is seen to be unclean and impure. So whilst Buddhists embrace the process of death, Shintoists may refuse to talk about death as they view it negatively. Finally, and although not a religious system, the Qi is the belief of a mind-body connection that guides Japanese nursing culture. A link to an inner spirit known as the Kokoro is highlighted as a source of protection of patients undergoing procedures involving the heart. The Japanese believe that donating the heart of a patient declared brain dead is highly contradictive. It is believed that the Kokoro is located in the thorax, and so patients showing brain death who donate their hearts have their spiritual ties cut short. Shockingly, a Japanese doctor was arrested in 1968 for performing heart surgery, and it was only in 1990 that carrying out heart transplants from brain-dead patients was legalized. Before we take a deeper dive into current scopes of practice, we must first gain an understanding of the impact historical culture has had on Japanese nursing. To do this, readers must understand the impact World War II had on the health of the nation. The war left Japan with high infant mortality rates, poor socioeconomic status, and tough health conditions. The government at the time positioned nurses as having the role of health promotion and prevention of disease outbreak. With this in mind, let's now look at the effects that these responsibilities have on nurses in modern-day Japan. Karoshi is a term that relates to the negative cultural influences in the Japanese nursing workplace. The word translates to death by overwork and is a term familiar to nursing staff across Japan, as is the term karajiotsu, which translates to suicide by overwork. According to a recently released white paper on karoshi, a majority of cases occurred during night shift hours. Some common issues for nurses in Japan are feelings of needing to prioritize work over family, working long hours, working consistent night shifts, working unpaid overtime, and having an unhealthy work-life balance. As elderly people make 30% of Japan's total population, it requires over 62% of Japan's network of qualified nurses to attend to them. Cultural beliefs and respect for the elderly from nurses are shown through a community-based framework. As a result, the government has created an efficient framework in which older people are examined through a complex health assessment to determine their needs. They are then connected to suitable community programs rather than residential care homes. Cultural competence is defined as understanding the impact of culture on the way people complete daily tasks. It is further defined as the ability to participate ethically and effectively in personal and professional intercultural settings. Cultural competence is developed through ongoing learning, experience, and reflection on care provided. In Japan, it has been suggested through cultural competence testing that there is room for improvement, with academics suggesting training within nursing programs is required. However, cultural competence training is not currently an aspect of Japanese nursing education, but should be due to the high influx of tourists nationally at 31.3 million in 2018 who potentially need medical care. To conclude, it is evident that the evolution of nursing in Japan has taken a significant amount of time and reform. However, scope of practice in the country is now on par with that of Western healthcare systems. The values and beliefs about healthcare in Japan is deep-rooted in religion, culture, and tradition, inspired by the impact of turbulent events throughout Japanese history. Burnout across the industry is a concern, but should Japan implement a sturdier support system to provide mental health support for their nurses, rates of koroshi should improve.